Joanne, this is CBC Radio 1 on the island. It's 9 minutes to 7 o'clock. Well, there's one doctor's office in Victoria that gets, on average, 5 calls a day from people looking for a family physician. You can do the math, what that works out to every year. And remember, that's just one doctor's office. Well, the Victoria area is not really special in this regard. There's a shortage of family doctors in our listening area in general, indeed across the country. In the capital region, there is a newly formed physicians group that's hoping to solve this problem. It's called the Victoria Division of Family Practice. Dr. Kathy Dabrus is on the board of directors, and she's on the line with us now to tell us more. Dr. Dabrus, good morning to you.
Good morning to you.
And the doctor's office I mentioned in the introduction is yours. What's it like getting all of those calls every day?
Well, thankfully, I'm not the one who has to manage those. Our front-end staff kind of do that, but it's over the years become increasingly difficult for them. Initially, they were able to refer people to other family doctors who had practices that weren't accepting new patients, but that's become more of an issue over the last few years.
And it's just the last few years, is it? Has it been building for some time?
It has been building for a number of years, absolutely.
So how bad is it? What is the shortage, or do you have a rough sense of it, of the shortage of family docs in Victoria?
It's hard to put a number on it, and because of that, the Division of Family Practice, which was formed in the last year, is actually doing a manpower survey for our area locally with the family doctors over the summer months to try and get a sense of where we're at for how many family doctors we have actively practicing. It can be somewhat misleading when we look at the phone book or look at a listing from the College of Physicians and Surgeons, because many family doctors also wear other hats as hospitalists or work in walk-in clinics, and so it's hard to know how many are actually there in what you would consider traditional family practice.
Okay, so this is part of the reason for forming your group in the first place, is it? To have a good, clear understanding of the lay of the land in terms of numbers of doctors and what they're all doing and so on?
It's part of one of the priorities that was identified by the local group of family doctors. Divisions are a new program within British Columbia, and so there are divisions in many communities. In fact, Victoria, as I say, just got started in the last year. There's another division close to us called the South Island Division, which encompasses Souk and the peninsula, and we're going to be working together with that division to look at manpower issues. But there are many issues within family practice, and we're looking at addressing things such as mental health care for patients in our community, long-term care issues within our community. But it's bringing together at a grassroots level the voices of family doctors and what are the issues in our community.
So what are people who can't find a family doctor doing in your experience? What are you hearing?
Well, for a number of people, they're really calling around to try and see if they can get into a family doctor. They're asking their friends and family members to see if they can get into a family doctor, see if they can get in that way. What we otherwise find is that people end up attending walk-in clinics and or the emergency room, and that's certainly less than ideal because many issues can be managed in a family practice. In fact, we do know that the key determinant of a person's long-term health and their lower use of healthcare resources is directly tied to having a family doctor.
And why, for instance, is it better to have a family doctor who you see all the time and who knows you rather than just, say, using a walk-in clinic whenever you as a patient might need it?
Well, you develop a relationship with that family doctor. Often there's a building of trust, and then recommendations that the family doctor can make are often followed through to a greater extent than someone you've just had a one point in contact kind of bit of information with. And the second thing is often in walk-in clinics and in emergency rooms, it's not their mandate to do as much in the realm of preventative care. And that's where we really see the high impact that family doctors make is in preventative care and long-term management of chronic issues such as diabetes and hypertension and things like that.
So do you have a sense then why there's a shortage of family doctors? I mean, is it a question of more med school graduates choosing various specialties over it, or there's just not enough medical school graduates to begin with, or what do you think is behind the shortage of family doctors?
There are a number of issues, and you've highlighted a couple of them, that there were reduced enrollments for a number of years in medical schools as a cost containment measure. Then within medical schools, for those graduating, approximately 10, 15 years ago, we hit a low of only 22% of graduates choosing family practice as their line of work upon graduating. And then a demographic issue that's affecting, many, many areas is we have a huge wave of family physicians who are looking at retirement. And so you kind of combine a smaller group of people coming in along the way to fill the shoes of people who are going on to retirement, and you have a shortage. And it's a Canada-wide shortage. But what we're trying to do is look at, we personally cannot solve the Canada-wide shortage, but what can we do to make Victoria a welcoming place for new family physicians?
And we've just got a minute left, Dr. Dabrus, but can you give us finally a sense of some of the things that you think might be done, even if it's just early stages of ideas? What might make Victoria a more appealing place to get more family doctors to come here?
Well, for a lot of people, it's they come to practice, and one of the main things we've heard from people new to town is developing a sense of community within the city that they live in, as well as developing a sense of community within the group of family practitioners in the area. So for our part, we're trying to be more welcoming and create a place that they can go to in terms of the division to find out about how things work in this community, perhaps link them up with a family practice person who can kind of show them the ropes. But I know even different areas, Esquimalt was looking at, how do we attract a family doctor to our area? And so there are certain things about office space, housing, those kinds of things. So I think we're trying to develop a plan on a community level within the family practice community and within the communities of Victoria.
Well, Dr. Dabrus, thanks for joining us this morning. Good to hear from you right now.
Thanks very much for the time.
Dr. Kathy Dabrus is on the board of directors of the Victoria Division of Family Practice.